Hey guys, now we are going to discuss about frozen shoulder, that is Apabahuka from Roga, Nidana. Frozen shoulder or adhesive capsulitis is a shoulder condition characterized by painful and limited active and passive range of motion. Frozen shoulder is reported to affect 2 to 5% of the general population and increasing to 10 to 38% of the patients with diabetes and thyroid disease. Individuals with primary frozen shoulder are commonly between 40 to 60 years old, and the incidence appears higher in females than in males. Shoulder has lost about 90 degrees abduction, 60 degrees flexion, 60 degrees external rotation, and 45 degrees internal rotation. The patient suffering with frozen shoulder will face difficulty in reaching into the hip pocket, difficulty combing hair, scratching back, and wakening at night. Here you can see the difference between a normal joint and a frozen shoulder. Let's talk about this in detail. What is frozen shoulder? Frozen shoulder, also known as adhesive capsulitis, and it is a condition characterized by stiffness and pain in your shoulder joint. Signs and symptoms typically begins gradually, worsens over time, and then it resolves usually within 1 to 3 years. Physiologic classification: primary and secondary. Idiopathic is primary. Secondary is known disorders. In systemic, extrinsic, intrinsic, known disorders will be there. The known disorders in systemic are diabetic mellitus, hyperthyroidism, hypothyroidism, and hypoadrenalism. In extrinsic, cardiopulmonary disease, CVA, that is cerebrovascular accident, and cervical disc and humerus fractures. In intrinsic, biceps tendinitis, rotator cuff tendinitis, rotator cuff tears, and AC arthritis. AC means acroclavicular arthritis. What are the symptoms of frozen shoulder? Frozen shoulder typically develops slowly and in 3 stages. Each stage can last a number of months. Now, what are the stages during frozen shoulder? There are 3 stages in frozen shoulder. They are freezing stage. A pain is developed in your shoulder anytime you move it. It slowly gets worse over time and may hurt more at night. And this can last anywhere from 6 to 9 months. You are limited in how far you can move your shoulder. The second stage is frozen stage. Your pain might get better, but your stiffness gets worse. Moving your shoulder becomes more difficult and it becomes harder to get through daily activities. And this stage can last up to 4 to 12 months. Now, the last stage is thawing stage. Your range of motion starts to go back to normal in this stage, and this can take anywhere from 6 months to 2 years. These are the stages that are involved in frozen shoulder. Pathology of frozen shoulder: chronic inflammation, perivascular infiltration, myofibroblastic proliferation, rarely subacromial bursitis, autoimmune cause, trigger points with myofascial pain syndrome, and local periarticular hypoxia. This is the cross-section image of shoulder joint. The first image you can see the normal joint, and in the second image you can see the adhesive capsulitis, that is frozen shoulder. In frozen shoulder, redness is the pain and the affected area. In frozen shoulder, a scar tissue is built up which restricts the movements inside the joint, resulting in pain and severe limited motion. Examination history. What is the site of pain? The site of pain is lateral brachial region, possibly referred distally into the C5 and C6 segment. It will be near neck area. What is the nature of pain? The pain varying from a constant dull ache to pain felt only on activities involving movement into the restricted ranges. The patient is often awakened at night when rolling onto the painful shoulder. Primary frozen shoulder and some secondary frozen shoulder is characterized by a progressive increase in pain and gradual loss of motion. Pain, especially sleep-disturbing night pain, frequently motivates the patient to seek medical advice. Most patients are comfortable with the arm at the side or with the mid-range activities, but often. So, what is the special test for frozen shoulder? Here are some special tests you can perform for frozen shoulder. They are needs test, Hawking candy test, raw palm test, slap test, empty can test, apply scratch test, lift off test. Special tests in pigment. In these tests, one hand should be placed on the patient's scapula and other on the forearm. Patient should fully internally rotate by thumb pointed down. Passively forward flex arm through full range of motion. The range of pain is equal to the range of impingement. What is the fastest way to heal frozen shoulder? Some tips are stretching exercises for frozen shoulder. Always warm up your shoulder before performing your exercises. And heat therapy are some fastest way to heal frozen shoulder. If you have any doubts or want me to improvise, let me know in the comment sections below. Thank you.